Hi, I'm Dr. Michelle Garvin, Director of Clinical and Sports Psychology here at the University of Maryland. And Maryland Athletics is excited to host the Terps Talk series to provide education, increase conversation, and reduce stigma related to mental health. Today, we're here with Dr. Yvette Rooks to talk about general mental health and some of the things that are impacting our mental health across the country today. I'd like to take time for Dr. Rooks to introduce herself.
Oh, good morning, everybody. I'm Yvette Rooks. I'm the Assistant Director of the University Health Center, Director of Sports Medicine, and also the head team physician here at University of Maryland College Park.
Thanks so much for joining us today. We're just going to jump right into it. And kind of thinking about your role in particular, could you talk a little bit about the parallels between seeking medical health for physical concerns and seeking medical help for mental health and behavioral health concerns? How might they interact and why might they be perceived differently?
So I think, in my experience and, being 25 years in the business, I've noticed that, the majority of people come in with physical complaints. They come in, my stomach hurts, my head hurts, I'm having chest pain, I get these aches and pains. And doctors, the way they are trained, jump right into, okay, did you hurt yourself? Did you fall down? Did you eat something bad? This. And they go down this litany. And oftentimes they'll get back, no, 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 no. So it stems on, to me, good training to say, I'm putting all this together. I've seen he or she numerous of times for, subtle complaints. Is something else going on? Because we know that there is a stigma with mental health in today's society. And it's up to us as clinicians to have that compassion, to have the wherewithal to be clued in with their patient to say, hey, let's talk about behavior. Let's talk about your mood. Let's talk about how you're feeling. Because I think that some of the things that are going on with your mental health may be contributing to your physical health.
Right.
Now, on the flip side, I'm a strong believer that if your mental health isn't going right, your physical health will take a hit.
Absolutely. Well, and so you kind of mentioned how, as providers, sometimes that's what's looked for first. Like we look for everything but what might be going on with our mental or emotional health. I wonder, I bet we probably do that ourselves too, right? If we have a stomach ache or something going on, we're trying to find that physical cause instead of thinking, I wonder if there might be something else going on too.
Oh, absolutely. You can go into any CVS and they're going to have all these over-the-counter medicines to fix your common ill that you may have.
Right.
And that's why I think it's very important that when people reach for a Tylenol for a headache, it actually says, don't take this more than 7 days, consult your physician, because maybe your headache is due to stress.
Right.
Maybe your stress is due to lack of sleep. Maybe the lack of sleep is due to your mood. And so we have to look in all that, but you don't go into a local CVS or Walgreens and find a mood enhancing pill.
Right.
You don't go in those places and find those kind of things, which could be the root of everything. And so, when you take the physical history, when you take a history, you have to include a mental health history. As a primary care provider, I wasn't trained that way. I had to learn that, and working initially in a outpatient ambulatory clinic in the middle of Baltimore, I had to tease out, why am I seeing Mrs. Jones every week for her abdominal pain? And why have I tried all these medicines and nothing worked? And sometimes you feel like a failure as a physician, but you haven't asked the right questions. So it takes a learning part. And that's why I think it's very important that both all the academies, internal medicine, pediatrics, and family medicine have added the PHQ-9 to part of a physical exam, which I think is really important. And then you have to expand on that. Everything is not depression either, but you have to expand on that. So I think it's also the clinician wanting to get to know the patient better. And I think it's also, as a clinician, Dr. Heal Thyself is not the answer either, is that we also have to seek out for help, and ask those questions instead of just assuming that that headache is what we think it may be.
Well, and I think you touched on a whole bunch of different things in your response. One being that sometimes let's take depression, for example. We always think about, well, that's our mood or maybe being sad, but there's a lot of other ways it presents too. It might be presenting as a stomach ache or a headache. And so really considering that. And you also mentioned that in training and now as part of physical examinations, we're doing mental health assessments. You mentioned the PHQ-9, which assesses for depression. But that's something that we're really looking for. And so again, identifying in ourselves, maybe I haven't been feeling physically well for a while. I wonder what my emotional state has been. Have I been stressed? Might I be feeling differently?
And that is so important to actually capitalize on how we can teach people about their moods at a young age. So, as we know here, and due to a lot of the efforts with Dr. Garvin, we not only do a pre participation physical exam, but our student athletes go through a pre participation mental health exam as well, and where they're surveyed lots of questions to ask. And so, when they come to their physical exam, or in conjunction with our mental health providers, we can also do that assessment as well. There's a lot of stuff going on in society today. Our children, our adolescents, our young adults are facing things that they've never faced. And now they're not facing anybody because everything is virtual.
Right.
And so there's a lot of stressors that are going on. And so I expect, and not only expect, we're seeing that the level of mental health challenges and behavioral health opportunities that we can get into are skyrocketing. And my friends who are in mental health professions are telling me how stressed they are because the wanting to fix everyone or be there for everybody and do everything is really affecting them. And
Sure.
so it's almost like, caring for the caretaker. We have this population that we're taking care of, our student athletes, who are facing not being able to be college athletes at this time because of the pandemic. We have social injustice that not only affects people who are brown and black, but also people who are yellow, white, and green.
Right.
Because our young people are like, what's going on here? Um, so they're trying to process all this as their minds are, just developing, and they're ending up with coming into the office where I just can't sleep.
Right.
My mind won't shut down. I'm having all this going on, and they're just looking at you because they really don't know how to explain it. And so, as Dr. Garvin said, that headache needs to just be addressed in more of a headache. And we have to ask those questions and ask those questions. And I'll tell you, I don't have all the answers. I have resources like Dr. Garvin, like Parker, like Shanna, like our external behavioral health providers, because sometimes it takes a team. As I've always, when raising my child, say it takes a village. It takes a village to help with these young people, to
Right.
get them to a place where they have a sense of peace, if that makes sense.
Right. Well, and so thinking about this, you touched on like the two pandemics we have going on. We've got COVID-19, we've got racial and social injustice going on, and you've talked about how this impacts us all. Not only has it made us more physically distant from each other, so we might not have those resources, but it can lead to stress and overthinking, which can contribute to sleep concerns. I also wonder about the piece with these two pandemics, how this is particularly impacting our communities of color, and how that we can talk a little bit about racial trauma and the impact on mental health as well.
Sure. Mental health, we don't hear a lot about it in the brown and black community because it's not talked about.
Right.
It's something that is put in the closet. It's not addressed because there's a shame attached to it. The word like crazy, you're different. Um, all those things, because before now, when there were opportunities to get help, it was more of the insane asylums, or you go to the hospital, they're going to give you all these drugs and it's going to change your personality. And there's a fear in the brown and black communities of medicine because of many things like the Tuskegee trials and other things that have happened in Baltimore. The hospital that I worked at and my colleagues at John Hopkins. So there's a fear of medicine with our the brown and black population. And so when you tag on mental health challenges, it's just not talked about. And so if one in a family is suffering from a depressive episode or anxiety or even post-traumatic stress disorder from seeing someone raped or seeing someone killed or seeing domestic violence at a very young age, we're supposed to suck it up, deal with it. Life is tough, get over it. Everyone has a bad day. And that's probably the worst thing you could tell to someone who's going through a mental health challenge.
Right.
But that's what we see. And then we see the rate of suicide increase, and we see the rate of, oh, you're bipolar. To me, bipolar now is a curse word. It should not be used like we use, hey, you.
Right.
But we see that. Um, and there are not enough mental health services, in especially our dense areas where we have a lot of brown and Black individuals. And that ties into COVID. We talk about social distancing and wearing your mask and, frontline workers. Majority of the hospitals, their maintenance staff, their medical assistant staff, not your RNs, are positions that are held, your linen people are held by people of color, but they're not considered first line workers. And
Right.
so they don't get all the PPE and things like that. And they go home and live with generations of families. So there may be a 3-bedroom home that 12 people live in, and they rotate by shift work.
Mhm.
That's cultural. And, it happens in other countries and that's the norm. But right now we're going through a pandemic where if someone comes home and they haven't been protected, they can give it to 12 people in their hospital, in their house.
Right.
We also know that healthcare disparities are greater in brown and Black individuals and actually in people who are low income areas in our cities. And so when there are not resources to get your preventive health care, like management for your hypertension, or there are food deserts where you can't get good nutrition, you have more of the high risk things that go along with COVID, like asthma, uncontrolled high blood pressure, obesity, and there's more immunocompromised. And so when we have COVID on top of the stigma with mental health, we really have a problem.
Right.
And it's taking its effect. There's almost every day there's an article in the paper about mental health with young people, older people, how it's becoming more pronounced, and things that were hidden or not dealt with for 5, 6, 10, 20, 30 years are really coming out now.
Right.
Unfortunately, we've seen a lot of suicides with medical professionals. And one can say that it was the exposure to COVID and what they see in the hospitals. But I really think that that's spent up years of maybe some behavioral health challenges that now is coming into a pinnacle because there is so much stress.
And
So
so,
it's multifactorial.
right, the current stressors being kind of that straw that broke the camel's back, not.
Absolutely.
Well, and you talked about, initial perceptions of seeking behavioral mental health care, that might be barriers. You've talked about some systemic issues that might be increasing concerns related to mental health and physical health, and also about just access.
Mhm.
Right. And so we have all of these factors contributing. You throw on top of that COVID and social and racial injustice, and we've got some big problems. Right. And you
And
yeah, so go
no,
ahead.
go ahead, Michelle.
Well, I was just gonna say, and you've talked about stigma too, and that being a piece that kind of interferes and can get in the way. Not only how we talk about it, you mentioned um, throwing around words like bipolar, but also stigma and seeking help and thinking about what do you think we can do to kind of move forward to reduce stigma related to this field?
We have to do exactly what we're doing right now. We have to talk about it. We have to talk about it at the dinner table. We have to talk about it when we want to talk about something else. And we have to correct people when they say those inappropriate things.
Right.
When they say, get over it, or use, like I said, call someone, oh, you're just bipolar when they have their mood swings.
Right.
We have to talk to our parents who lived during those times when there weren't resources and let them know that I'm not doing too good, you know, but we have to educate the right way. And because you can educate the wrong way, but educate the right way, but it has to be out there in the present. But with that, we also have to have access and not label people because of that. And that's going back and, it's a pipeline. It has to start in kindergarten.
Yeah.
um, and making it known in books and letting kids know if you're having a bad day, we could talk about that. But when you start having bad weeks, we have to address that.
Yep. I think that's so important, right? The big part is let's have these conversations. Let's talk about it. It's okay to talk about mental health. It's okay to struggle emotionally. But letting people know that is the big piece, right? It's okay. And I like how you identified like everyone has bad days. Let's talk about those bad days. But if it goes on for an extended period of time, let's get support. Let's get help.
Absolutely. And one of the most things that I'm proud about in coming here and working here is that I have seen a culture change since I was here beforehand with our young people being able to have resources. And, in Terp One magazine, I read, and there was a great article in there, and it was just very proud of the young people who said, I'm going to share my story,
Right.
and, having coaches back them. And I just think it's awesome.
Yeah. And so seeing that shift a little bit within the smaller community that is Maryland athletics. Okay.
Yeah, I think the shift starts here. And as we educate this population, they educate their friends, they educate their parents, and it's a trickle down effect because I've had a couple of not healthy conversations with parents about what's going on with their children with their permission. And it was almost like, no, not my child. But as we got into the conversation and I call them children because they are, um, and when the student athlete gets involved, said, yes, mom, or yes, dad, I've been struggling for a while. I
Right.
need you to understand. It really opens up eyes.
And so that's a big education piece too. And, one of the things that's hard is knowing how to get the right information. One of the things that we're doing as part of this campaign is putting together a website with some resources. So for those who are out there who don't really know where to go, definitely check out umterps.com/terps talk. We're going to have resources, not just general resources related to mental health, ways that you can get trained or get more involved, how you can become part of the national conversation, and some resources to find support for yourself or others. So definitely check that out. But in wrapping up, thinking about Dr. Rooks, from you, what are some suggestions that you have for others to enhance their mental health and their behavioral health and support others who might be struggling? What are a couple of tips that you have?
So I always tell kids, when you get up, rank your mood, write it down. Keep a journal of how you're doing. We're everyone's so scheduled. Put it in your phone, and then look at it over the past week. If it's just a smiley face or a sad face, and if you don't have, if you have those documentations, you're not doing good. Please call. Walk into one of our offices. Pick up the phone. Do it anonymously, but get help. Look at your sleep. Sleep is really, really important. And don't try to tackle this problem alone.
Right. Right. Well, those are really great tips and ideas. Thank you so much for joining us this morning. We appreciate all of your insight and everything that you do to help our community as well.
Thanks for having me. This is great.